Good morning, everyone. Today, I'll be presenting a paradigm shift in management of ROP. I have no financial disclosures. Coming to the aim of our study was to investigate the efficacy, safety, and anatomical outcomes associated with intravitreal anti-VEGF, ranibizumab, in treatment of ROP. It was a retrospective study of 24 infants was conducted at Tertiary Eye Care Hospital. The screening criteria were gestational age less than 32 weeks, birth weight less than 1.5 kg, any unstable clinical course as determined by primary neonatologist. Staging was done as per ICROP classification and indication for treatment was followed as per ETROP. Under all aseptic precaution, IV ranibizumab 0.2 milligram in 0.02 ml was injected in each eye 0.5 to 1 ml posterior to the limbus under topical anesthesia with a standby presence of anesthesiologist. The follow-up was done on next day, alternate day, and then weekly and monthly followed up for done for 6 months. Around 60% were male babies. Around 80% babies were delivered by cesarean section and one-third had RDS. 8% babies had septicemia, whereas 16 had anemia. The mean gestational age was 32 weeks and mean birth weight was 1.4 kg. As we can see, nearly 60% had zone 2 involvement. Around 40% had APROP. Result were defined as a total of 48 eyes were treated with ranibizumab. Treatment success was defined as complete regression of ROP and vascularization into zone 3, which was observed in 75% in our study. Secondary treatment success was when additional laser was given. That was needed in 25% of the cases. Major complications were defined as corneal opacity, lens opacity, retinal or vitreous hemorrhage, retinal detachment, optic atrophy, or patient mortality. None was seen in our study. A REDCam image of left eye is showing zone 2, stage 3 APROP. After a single IVR, patient condition was resolved completely, which can be seen at 10 months follow-up. Coming to the other case, a REDCam image is showing zone 2, stage 3 APROP. Complete resolution did not occur after a single injection, so laser ablation was done. A good outcome was observed at 6 months. Indication for retreatment are poorly defined. In our series, retreatment was done at mean age of 44 weeks, corresponding to the 8 weeks of post-IVR. Our recurrence window was noted earlier than Minz-Hinster study, where the mean age for retreatment was 51 weeks, corresponding to the 16 weeks post-IVB injection. Rationale for the anti-VEGF therapy. ROP is a biphasic disease with initial vaso-obliterative followed by vaso-proliferative phase. There is only a single burst of VEGF which causes the neovascular growth in ROP. This differentiated from other neovascular diseases which has a continuous VEGF release. Delay in anti-VEGF treatment when VEGF levels are decreasing may not be as effective and may promote the fibrosis. This is a recent change in protocol to treat ROP aggressively early with anti-VEGFs. Consequent to this, in our study, the overall rate of retreatment was only 25%. And in other studies, it has been reported in the range of 13 to 35%. Other studies, various studies of intravitreal anti-VEGF shows treatment success in range of 95 to 45%. We found it was around 75%. Ranibizumab has 10-fold higher binding affinity, smaller molecular weight, one-fourth intravitreal half-life. So theoretically, it has better efficacy and systemic safety profile with less neurological deficit and developmental delays. LION-R did not show any neurodevelopmental delay, although the babies requiring rescue therapy for recurrences did demonstrate a higher incidence of psychomotor and mental impairment. Coming to the RAINBOW trial, which we were part of. It was a randomized open label trial with 3 arms having intravitreal injection of 0.2, 0.1 dose and a laser. Treatment success was observed in 80% with 0.2 dose, whereas it was 66 in laser group. Coming to the conclusion, we found IVR achieved a stable retinal vascularization with low rate of complications and fewer recurrences. Ranibizumab appears to achieve a similar anatomical outcome as bevacizumab without additional risk for major complication or systemic side effects. Further prospective randomized studies with larger sample size are required to confirm this observation. It was a small retrospective study with appropriate control. Study population was limited to the Asian patients with tertiary hospital setting. We did not perform FFA. The take-home message will be early diagnosis and treatment with IVR is key factor in treating ROP babies. Single timely injection with adequate follow-up is an effective management.
Thank you, Dr. Purva. I think it's a good message. And the in thing is anti-VEGF for these small little children, and which is safer. You are right. Anything? I mean, in cases where you had done laser photocoagulation additionally, so what was the incidence of myopia?
So we have followed only for 6 months, but we are following the babies.
Right.
One question I just wanted to ask about the birth weight. Your cutoff birth weight is in fact lower, which is for Indian setup. In India, we see higher birth weight babies. I think your cutoff was less than 1500 grams.
Yes.
Isn't it? So
Yes.
how do you comment on that?
Ma'am, ours is a tertiary hospital referral center. So more babies are coming for the NICU admission, and then primary neonatologists used to send us. So we observed that the baby's weight was less than 1.500 grams, and they used to send, so we used to screen.
That means only inborn babies were taken.
Yes, ma'am.
Not other, because otherwise it goes higher.
Yes, ma'am.
Thank you.